name is Sam Schwartz, Superintendent of Schools for Kemp Independent School District.
For 36 years, Sam Schwartz has worked as an educator across the state of Texas.
I began in the South Texas town of Kennedy, Texas as a teacher-coach. From there I went to Goliad, Texas and became athletic director and head football coach. Went back to my hometown of Fall City, Texas as high school principal for 3 years. And then came up here with a friend of mine who became superintendent.
Whether shaping minds in the classroom or molding athletes on the field, Sam has a passion for seeing people succeed and grow. And his wife, Peggy, also shares his love for education, working at Kemp High School as a coach of volleyball, cross-country, track, and cheerleading. Together, the Schwartzes have helped thousands of students achieve dreams of college and careers.
Some of the greatest rewards is seeing people be successful and knowing that I had something to do with that.
Sam has always considered himself healthy and athletic. He played football all through high school and even got a scholarship to play tight end at North Texas State University.
I owe a lot to football. I owe a lot to sports. My coaches, my teammates, trainers, managers, they all mean a lot to me, and they've all helped me be successful and pretty much helped me along to where I am now.
Despite grueling years on the football field and the challenges he has faced as a teacher and coach, in August of 2010, Sam would find himself facing the toughest opponent of his life.
Actually, I went for just a physical, a checkup, and my blood work didn't look good. I had calcium amounts that were too high.
Increased calcium levels can be caused by some types of cancers, including kidney cancer. Unfortunately, that was the case for Sam. A CAT scan showed a large tumor in the left kidney.
And then I was referred to physicians at UT Southwestern, and that was the best thing that's ever happened to me in my life.
At UT Southwestern, Sam had an MRI of the abdomen to find out exactly what he was facing.
Here you have an image showing the normal kidney on the right, the left side of the patient. You see this large mass replacing what it was before a normal kidney.
The team at UT Southwestern confirmed a cancerous tumor 9 inches in diameter had almost completely taken over his left kidney. Despite the advanced cancer, Sam had almost no symptoms.
And some patients early on may have pressure and pain and symptoms, and yet other patients, through no fault of their own, can have a massively enlarging tumor that doesn't produce any acute pain or pressure sensation. It's hard to imagine.
The team at UT Southwestern knew they had to move quickly and brought in Dr. Arthur Sagalowski, a urology surgeon with more than 30 years of expertise, to remove the deadly tumor.
The goal of the surgery was to thoroughly and totally remove the kidney, all of the fat around the kidney, and the adrenal gland, which sits on top of the kidney.
6 hours later, Dr. Sagalowski and his team had successfully removed the entire tumor. The results were as good as anyone could have hoped.
He had a very smooth post-operative course, and interestingly, as soon as his tumor had been removed, his blood calcium, which had been difficult to control from being too high, returned to normal level.
The normalization of calcium levels after the surgery was encouraging, and a CAT scan 3 months later showed that all the cancer had been removed. After the surgery, the tumor was turned over to Dr. Payal Kapoor, an expert on the pathology of kidney cancer.
So any time a patient has a procedure where tissue is taken out, it is sent to pathology. So Sam's case is a little unique in the sense that it was a very large tumor. Most renal tumors have smaller nuclei. There's not so much of variation in nuclear size. So here you have a tumor which is looking really aggressive.
The tumor cells appeared void, and UT Southwestern doctors diagnosed Sam with a clear cell renal cell carcinoma, an aggressive form of kidney cancer. As it turns out, the tumor Sam had was even more aggressive than originally thought.
Our team at UT Southwestern, led by Dr. Brugarolis, recently showed that around 15% of clear cell renal cell carcinomas have an abnormality in a gene called BAP1, we showed that these tumors have a more aggressive behavior. Patients who have mutations in BAP1 gene have 3 times higher chances of dying due to their cancer.
UT Southwestern scientists discovered that not all clear cell renal cancers are the same. Cancers are caused by mutations in genes, and the team found that depending upon the gene that was mutated, kidney cancers could be divided into very aggressive or less aggressive tumors. Dr. Kapoor was the first to develop a test for BAP1 in kidney cancer, and using this test, she determined that Sam's tumor had lost BAP1. Normally, kidney cancer cells express the BAP1 protein, as shown by the brown staining. However, in Sam's tumor, the only cells that stained brown and were positive for BAP1 were normal cells that were infiltrating the tumor, such as from blood vessels. Thus, the cancer cells had lost BAP1. Tumors that have lost BAP1 are significantly more aggressive, and UT Southwestern investigators showed they carry a reduced life expectancy with them. Despite the aggressive cancer, Sam began an even more aggressive course of treatments.
The CT scans at 3 months did not show any evidence of cancer. However, at 6 months, a CT scan of the chest showed that he had lung nodules that had increased to about 1 centimeter in diameter.
While these nodules were still very small, Dr. Wadamul, an expert interventional radiologist, was asked to attempt a biopsy to definitively establish a diagnosis. Unfortunately, the biopsy came back positive for renal cancer. Kidney cancer most commonly goes to the lungs, and once it spreads, oncologists use a series of 6 risk factors to determine the life expectancy of patients. These include the time from diagnosis of the original tumor to the development of metastases, as well as hemoglobin and calcium levels. Sam's risk factors put his tumor in the intermediate risk group. His cancer had metastasized within just a few months after the surgery, and his life expectancy was estimated at just 2 years.
When I got together with Sam after he had been diagnosed with the lung nodules and we had determined that those were metastatic, I was very concerned. We discussed different treatment options. Despite the recent approval of several targeted therapies, the only potentially curative treatment option available today is interleukin-2.
After some discussion with Dr. Brugarolis, Sam decided to go for interleukin-2. It was a challenging treatment, but CAT scans after the IL-2 showed the lung nodules had disappeared.
This patient received IL-2 therapy, and as a result of that, we can see a very nice resolution of that nodule on the follow-up scan performed a few months later. You can see how that nodule is no longer visible, and instead you see the normal vessels in the lung.
3 months later, another set of CAT scans confirmed that the lung metastases had disappeared.
You have a tumor which has necrosis, and you have cells which are looking rather very aggressive. And it's quite amazing how well he has done in spite of all these features.
For an entire year, Sam showed no signs of cancer. However, a year after the success of the IL-2 treatment, a small nodule, approximately the size of a silver dollar, showed up in the renal bed. The nodule was biopsied and came out as kidney cancer. Although it was small, removing this tumor had immense challenges. At that point, Dr. Brugarolis decided to bring in the multidisciplinary team to determine the best plan to fight this latest recurrence.
We get together to discuss patient cases that require the involvement of the different physicians. And at this stage, with a recurrence, we needed to decide whether he was going to be treated with surgery, radiation, or drugs.
After a lengthy discussion with the team, radiation therapy was deemed to be the way to go. Radiation therapy is not a standard treatment for kidney cancer metastases outside the brain or bone, but protocols have been developed to administer high doses of radiation, and this has proven effective.
We treated that with stereotactic radiation, and in his case, I think that it took different skill sets along this path that he went through to try to get this tumor under control.
With the support of his family, friends, and physicians, Sam has blown past the 2-year life expectancy for people with his diagnosis and is presently cancer-free. This team mentality and approach permeates every part of Sam's life, so it was only fitting that his cancer treatment be delivered as a team.
The team causes you to work harder, and people who play as a team will win as a team.
At UT Southwestern, we are very unique in how closely we work with one another.
I think that this is the model that many comprehensive cancer centers have tried to adopt, this notion that you assemble a team that all of which have different skill sets, all of which have different perspective, but the key is that none of them are satisfied with the current outcomes of cancer patients.
Sam has done very well, and this is very rewarding. As a physician, it's very exciting to be part of somebody's journey and to help them fight their disease.
Although cancer-free today, Sam's journey is far from over. He still drives an hour to UT Southwestern every 3 months for scans looking for any possible recurrence of cancer. And if that day comes, the approach will remain the same. Consult with a team of kidney cancer experts to determine the next move in Sam's war on renal cell carcinoma. While the future is unclear, one thing is certain. It has been more than 3 years since Sam's diagnosis, and thanks to his team at UT Southwestern, he can look forward to each new day.
Well, I look at UT Southwestern as a great family of physicians and all the support that they have, and I wouldn't be here without them. That's the bottom line.